Whether you're an expecting parent or just curious about the journey of motherhood, you have come to the right place. Yes, today we'll be covering the topic do's and don'ts during pregnancy because we are all worried about the weight gain guidelines, the importance of prenatals, managing discomforts like nausea, sleeping on the stomach or your back, climbing the stairs, traveling during pregnancy, warning signs, etc. So stick around for some valuable insights with our expert today. And remember, if you have any questions, please drop in them during the session at the comment box, and we'll be happy to answer them. So Dr. Sindhuri has joined, who's a DNB OBG, an infertility specialist, natural birth specialist, and a fellowship in cosmetic gynecology.
Yeah,
Hi, Dr.
hi all.
Sindhu.
Yeah, hi, Palak. Yeah, hi.
How are you?
I'm good. How about you?
Good. Welcome and thank you for joining us today for the
Yes,
most talked about topic during pregnancy, right? The moment
yes,
you
yes,
can, right, we see those two blue lines or we get that beta HCG blood test done. We are
yes,
really happy, right? We
yes.
want to share it, but we are scared. Yeah,
Mm-hmm.
anybody who is a first time mother is scared, and they're like, what are the so I want to ask you that first question
Mm-hmm.
is, what are the essential do's for a healthy pregnancy?
So, firstly, as you said, for the first pregnancy, anybody will be very much excited. At the same time, they'll be worried what to do, what not to do. So, even they'll be constantly asking, in like whether I can go out, whether I can drink this juice, coconut, because multiple people will be putting them multiple ideas. Suppose some will say coconut water is good, coconut water is not good. The doctor will say coconut water is good, orange is not good. So a lot of things. It's not about food. Even going and to a restaurant, going and watching a movie, meeting a friend also. That anxiousness will be there for the patients.
Yes.
So which is common, expected in all the patients these days, not because in the past days, I mean probably 20 to 25 years back, this thing won't be there because they used not to concentrate much on all these things, but these days pregnancy is precious for everyone.
Yeah.
So what I say, do's and do nots is like do's, you can do everything which you are comfortable, except suppose if your doctor says no, to avoid a certain things, certain exercises, or asks you to take rest for some time, avoid traveling, yes, then please do follow according to it. And if you're not comfortable doing something, like suppose if you go for a movie, because of the sounds and all, if you're not comfortable, please avoid it. And if you go to a pub or a restaurant where you feel the sounds like make you uncomfortable, because initially in the first few weeks, till 12 weeks, many of the patients do have nausea, vomitings. Most of the patients do suffer with that. So actually this sounds, lighting, all will trigger again the nausea and vomitings. So ideally it is better to avoid going to places where you have more sounds and lighting and all. And coming to the food, we always say eat healthy for all pregnant women. It is very easy to say, but they crave for many things actually. Like they crave for ice creams, they crave for spicy food, uh, many crave for pani puris and ice creams. But see, eating healthy will help them to maintain their weight, and to let them not have much complications like BP, sugar, and all. And they'll also help the baby to grow. Also helps the baby to grow nicely. I mean, proper, without any lack of fluid or anything. So I always suggest, it's easy to say for me to eat healthy diet, but it's very hard to follow. But it's for the betterment of you and your baby in the future. So every time when a patient comes, I ask them to eat healthy, healthy, healthy. Why? Because see, in the longer run, see, the amnio, they say, few of studies say that whatever you eat, the taste goes into the amniotic fluid. of the baby. So the baby will be like when you're weaning off from breastfeeding, it will be easy for the baby to like those foods which you ate in your pregnancy. So your baby is tasting, your baby is hearing what all you say and what all you eat. So think wisely and eat. So that's what I say to all my patients. And then I ask them to drink plenty of water. That's a must and should, because drinking more amount of water decreases your chances of infections. It helps in easy digestion. Even it helps with the nausea also. So when you're having so many benefits, please do drink good amount of water. Do not drink much coffee. If you can avoid coffee also, that's perfect. Avoid alcohol, avoid smoking, and avoid stress. The big do not is avoid stress. Stay happy. Even if it is your second pregnancy or third pregnancy, enjoy it, because this, your second will be second forever. Nothing can replace it. This journey should be remembered. Embrace it with love and all. And I always say to the family also to support the pregnant woman, because there'll be so many changes they'll be experiencing. They'll be having a lot of mood swings and everything. But being a supportive family member is very helpful for the pregnant lady. So,
So I have to add here,
mm-hmm,
Dr. Sindhuri, actually, आपने जब हमें बताया that, whatever we, like a woman eats during pregnancy, the
mm-hmm,
taste goes into the amniotic fluid. But,
mm-hmm,
when our ancestors, our Dadi Nadi said that in
mm-hmm,
pregnancy for 2, they didn't mean to eat the quantity, but they meant to say that आप जो खा रहे हो वो taste आ रहा है, and later you will, bear the brunt of it if you're not eating good
mm-hmm.
food. So
Yes,
we've
yes,
taken
yes.
that eating for two is meaning eating that much more food and that much
Uh,
more quantity for two people. But now
mm,
today I say to it's not a completely wrong saying that you eat for.
mm-hmm. Yes,
So thank you for answering that. And
yes.
before, for the don'ts of the pregnancy, you've already told us,
Mm-hmm.
the big don't,
Mm.
which is stress,
Yes,
right? And
stress.
obviously the symbolic, no alcohol, no smoking, eating healthy. But do you think there are any other don'ts which are like a major no-no for a pregnancy? Like no matter it's a normal pregnancy or a high-risk pregnancy, you should avoid that completely.
Avoiding completely is I strictly ask patients not to travel for till 12 weeks,
Okay.
because till 12 weeks is the first 3 months. A big no-no from my side. But some patients do understand it, and they do it. Some do not. Why? Because see, whatever it is, the in the early phases, it will be just implanting, and it will be settling into our body, into our uterus. So we should give it time. Whatever the complications happen, like bleeding or pain or anything, any sort of abortions happen in the first 12 weeks. So ideally, I ask strictly my patients not to travel till 12 weeks. So I ask them to go for a baby moon or whatever moon from 13 to 28 weeks. That's the safest period to travel. So do that. And there is, see, we don't say any food, because eating any food will not cause abortion. Nothing has been scientifically proven as such. But if your parents or anyone say to avoid 2 or 3 foods, it's okay to avoid, because suppose in just in case if you have any complications in future, that will be running in back of your mind, probably because of that it is happening. So that you can opt. And more than that, there is nothing. So restriction of activity and all. Suppose if you're having any complications, like bleeding or something, when your doctor asks for bed rest, yes, you can have bed rest. And heavy lifting exercises is what we don't advise them. I mean, people, like suppose they are weightlifters and they become pregnant, fine. But if somebody is lifting weights and doing aerobics in pregnancy, strictly not advised. uh, Apart from that, there is
Do something.
nothing that you need. There is
So,
nothing that you need not have to do in pregnancy, apart from this.
so basically, don't do something which you've not done before. If you're doing it from
Yes,
before,
perfectly. Even tasting as new food is also no, because some people think, I mean, they try prawns for the first time in pregnancy.
Okay.
because some relative got it from some place and say you're pregnant, no, please don't try anything new. What all you had in your previously, like they will try new and they'll say I got allergic and all. So we get a lot of tension after having that. So better to avoid. No, it is not better. Please don't try new foods or new soaps or nothing new to be tried, because see, new soaps or like new material of clothes also sometimes can irritate because it will be very sensitive. It is better to avoid such things in pregnancy.
Okay, so since we're talking, about food and allergies and allergens,
Mm,
and so many
mm,
things, I want to understand now, with this new lifestyle we all live in, right? What is
mm,
the importance of vitamins and supplements during pregnancy? Because
mhm,
mostly, that
mm,
pregnancy are like, not high risk, or they've not had
mm,
gestational diabetes or
mm, mm,
hypothyroid, hypertension.
mm, mm,
I really want everybody to have pregnancy without all of this. But even if you're having without all of this, right, or any
mm,
other
mm,
underlying issue,
mm.
what are the importance of vitamins and supplements as a gynecologist? Like, because you
Yeah,
guys are
yes, yes. So, our favorite drug in pregnancy is folic acid. Our most favorite, because we ask patients who come for pre-conceptional counseling also, even before they get pregnant also, we ask them to have folic acid. Why folic acid? Because it prevents neural tube defects.
okay.
So whatever problems the babies will be having from with the nervous system and all, it prevents. So, and sometimes when people have the deficiency of folic acid also, their babies can have neural tube defects. So that is the reason we ask patients, like all the pregnant women, when they're planning also, before planning, before 3 months only, we ask them to start. Why? Because see, you miss your period and you check it after 1 week or 2 weeks. Once you miss your period, by then you'll be almost 6 weeks. We'll calculate from the last menstrual period. So ideally, the organs and the nervous system organogenesis is basically the organs tend to form between 6 to 8 weeks. So by then you should be taking. Suppose in patients who are having this PCOD and all, they'll be having irregular cycles, and like they'll be used to getting periods for every 40 to 45 days. They'll not know even though missed. So suddenly it will be a surprise for them. So that's the reason we ask them to use 3 months prior onwards folic acid. So that is the importance of folic acid. It can be continued till delivery, but must and should till 12 weeks is what all doctors advise. Coming to iron, yes, Indian women specifically are very much anemic, like, and we have anemia prevalent all over our country. That is the
At the
reason government of India only, I mean, the government only supplies free iron and free
They run a
calcium.
program for
Yes, uh,
like,
anemic
treat-
women. Yes, see, because I mean, most of women in India are malnourished, is what I feel. They'll not
yeah.
eat properly, or they'll eat food which doesn't have any vitamins or doesn't have any iron. Some kurkure, some lays, something, samosa, which doesn't have any vitamins and all. So that is the reason most of the women in India will be iron deficient, will have iron deficient anemia. That is the reason we supplement them with iron, certainly. And sometimes, see, out of 100 patients, considering 6 to 7 patients will be allergic to iron. Allergic as in, like, they'll have constipation in their pregnancy, and some people might be having very bad gastritis when they take iron. In such cases, we ask them, there is no other option. Like, we can try syrups, but even syrups also do cause that nausea, and because it's basically the composition, the element which is causing them the all this symptoms. So we ask them to have food which is rich in iron. So iron is very important. And coming to calcium, calcium is also important for the baby's development, growth, bone development, and all. And also, you need to have a lot of strength for to deliver a baby. It is not so easy. It's the worst pain a human can face in their life. You cannot experience. I mean, we cannot tell it with words. So to go to that phase and to experience, I mean, when you are in that phase, you should be capable to go through that phase. See, during delivery, you can have postpartum hemorrhage, like you can have heavy bleeding, and there are few cases like people neglect taking iron, and they'll be their hemoglobin will be around 6 or 7 by due on their delivery day, and suddenly they'll lose much blood, and they can go into that shock phase also, like having hemoglobin 7 and losing a liter of blood, and their hemoglobin will fall to some 4 or 5. So finally, this iron deficiency anemia is leading to something and something. So iron is very important. The same time, calcium is also very important, and vitamin D supplements also we give for patients, because vitamin D deficiency is not so good for the baby's development. So we supplement all women with vitamin D so that the baby will not have any growth restriction. Simultaneously, will prepare the woman also to be capable to deliver vaginally or through cesarean section, either ways. And one more drug we prescribe, one more protein powder is what we prescribe, because with DHA. Why? Because DHA is very important for the baby's brain development. So, in the longer run, supplementing a pregnant woman with DHA is very helpful for their babies to have good IQ, and they'll be very much sharp compared. There are very many studies which show women with who have taken DHA and women who haven't taken DHA. So their kids tend to be more sharper. The studies say so. DHA is very, very important, and simultaneously, protein is also very much important. See, if you decrease the amount of carbohydrates in your diet, completely fine, but include good amount of vegetables, good amount of protein in your diet, because protein is very much needed for the baby's growth development. I mean, growth and even the size of the baby, weight of the baby is also, for that also protein is very much needed. So that's the reason we prescribe a ton of medicines. Apart from this, we do prescribe progesterones also. Progesterones are basically to support the pregnancy. In people who have had recurrent abortions, or in whom it is very precious in IVF pregnancies and all, they keep progesterone support. So that varies, but these are the regular medicines. This iron, calcium, and folic acid is a regular medicine to all the pregnant women.
Okay. So before we move on to, the next section, which is what are the some common discomforts during pregnancy and how they can be managed, I have some questions which we've received in the comment box
Mm-hmm.
and on Instagram post
Mm-hmm.
for you. Ma'am, I am 3 weeks pregnant. She's like, maybe she just came to know and it's recent.
She's pregnant.
Can I sleep on my stomach? That's the way I sleep. So should I sleep on my stomach or change my position to, on my back, on the right, on the left? She has this question. So
So
please.
the best sleeping position in pregnancy is left lateral position or right lateral position. We don't advise them to sleep straight also. Forget about ulta. We ask them not to sleep straight also, because see, now the pregnancy is very small. Now that you're 3 weeks or 4 weeks or 5 weeks, till uh, 10, 12 weeks, the uterus will not grow in size. So that it might not be difficult, but going further, what happens is, as the uterus is growing, it will put pressure on the major blood vessels. Thereby, suddenly your BP tends to fall. Thereby, the blood supply to the baby also tends to fall, and baby might not get sufficient oxygen supply when you're lying down straight. So, ideal position is left side or right side. That's the best position, and try to get it habituated from now onwards. That will help you further.
I hope your question was answered. And now I have a next question. I have a lot of back and muscle pain in my pregnancy. How can I, subside the pain?
Yeah. So, see, because why a lot of back pain specifically? Because, see, uterus will, there'll be a small, tiny bone called coccyx, which is very small, tiny. So, the uterus, as the uterus is growing in size, it will put pressure on it. And yes, you will have back pain at the tip, I mean, just the end of the back. So, what are the things that you can do to, I mean, decrease that pain, not avoid, so we cannot avoid, decrease. Hot water bag is the best solution. That will be your best friend throughout your pregnancy. A hot water bag and a pillow will be your best friend. So keep hot water bag wherever you're feeling pain. Lie to your left side or right side. Ask someone to keep, or you yourself can also keep. If it is not subsiding, then you can take any oil, maybe almond oil or whatever, olive oil, whatever oil, and just heat it little, make it lukewarm, and just with 2 fingers, just massage it downwards wherever you are having pain. So these things work very well, and probably with these 2 tips, probably okay, your backache will decrease at least 60 to 70%. And coming to muscle, see, there'll be stretching of all the muscles. What you should do, you should just muscle weakness, muscle cramps can be there because of some vitamin E and deficiency also. So do good walking, take plenty of water, take all the supplements that are given by your doctor. If the pain is not subsiding, you can ask your doctor for vitamin E supplements also, or you can eat foods which are rich in vitamin E. That also can help. So apart from that, we ask patients to eat daily 2 egg whites, which will be helpful, which will have vitamin B12, and even good amount of protein and calcium will be there. So your another breast friend is 2 egg whites daily.
And if somebody is a vegan or a vegetarian,
Vegetarian, they can eat paneer, alternatives to egg.
okay, out. Now, my next question is like, is it okay to feel less baby movements in the third trimester? I don't know how
Uh,
much is too much and too less, but yeah.
yeah. Yeah, actually, yeah, either of it, as you said. Some people will be saying, I'm feeling too much of movements. It's okay. Sometimes the baby will be very active. Don't worry. No, it is troubling me a lot. We cannot do
I think
like anything to decrease the movements of the baby. But sometimes what happens is in the third trimester, which is 28 weeks plus, how many movements you should have is the first question that many of my patients ask. 12 to 15 movements in 24 hours is a normal thing. See, sometimes what happens is uh, patients might be having too much of fluid, more like a, or very less fluid. Either cases, you will not feel much movements. When there are too much of fluid, your stomach, your tummy will be very tight. You will not perceive movements that nicely. Or suppose for a woman who is having too much of abdominal fat also, the perception of movement will be less. So in that case also, suppose you are having less fluid, the baby will not have space to move much. So in that case also, you will not have much movements. So when should you approach a doctor? If you're not having 12 to 15 movements in 24 hours, please go and meet a doctor. Suppose today at somewhere around 6 o'clock, you don't feel movement. Then what you should do, since for 1 hour you did not feel any movements, what you should do is drink or eat something. Drink anything hot or eat something, maybe a sweet or something, or and lie down on your left side. Keep your hands on your tummy, and switch off all the lights. Concentrate on the baby. Then you'll feel movements. If still you're not feeling movements, then please go and meet the doctor. So,
which brings me to my next question, which has become very, very popular, is
mm-hmm,
like decrease in the amount of amniotic fluid and what
mm-hmm.
to do. This we have heard
So
repeatedly. Very important.
yes. So, if the amniotic fluid is less, what you should do is it depends on how much decrease it is. Suppose if it is very severe or mild to moderate, what you should do. Plenty of fluids. Drinking plenty of water, plenty of coconut water also helps. This all help in increasing the amount of fluid. How much increase? That exactly we are not sure, but drinking good amount, taking adequate hydration is the solution. Approximately 4 to 5 liters of fluids per day if you drink. Yes, there are proven benefits that your fluid content will increase. And why do you have first of in the first place, why do you have less fluid? Because sometimes when you're very much dehydrated, or sometimes unknowingly when there is a leaking, unknowingly high leak or low leaking of water fluid, then also you can have less liquor. So your doctor will evaluate the condition, and accordingly she will guide you. But she'll write you some sachets which will increase your fluids, and you should eat. What you should do from yourself, drink a lot of water. You can drink coconut water, you can keep drinking ORS, and you can take good amount of multivitamin, whatever what all the doctor has prescribed. You can take all those. Drink, eat a lot of fruits also, and juices. That all help in increasing the amniotic fluid.
Okay. Thank you so much for answering
Yes.
that, because we've got that repeatedly.
Huh.
A lot of mothers have been asking that. I don't know why. There's a shoot in this question.
Yes.
My next question is, how much weight gain is considered like healthy and normal during pregnancy? Because earlier
Yes.
pregnancy can go all at about picking up 10, 20 kg of weight, but I think now girls and new mothers have become conscious about
Yes.
gaining
Yes.
appropriate weight.
Yes.
That's
Yes.
that's the second question.
Yes. Yes. So ideally, we say from 8 to 16 kgs is the ideal weight gain for a pregnant woman. But what happens is it differs from person to person. Like some might gain only around 8 kgs in their whole pregnancy. Some might gain around 20-25 kgs also, which is not good. So, for the people who are gaining less weight, we will see whether the baby is growing in good weight or not, and is the baby having good amount of fluid or not. Is the baby's weight is according to her gestational age. We will see that in people who haven't gained much weight. So if that is correlating, even if that is enough, we are very much happy. We want our mothers to look in the best of their shape, even in their pregnancy also. Just that we want the baby also to grow in appropriate size. Then I'm completely fine. Even if you don't gain like more than 6 or 7 kgs, and the baby is growing perfectly perfect. I'm very much happy. And coming to overweight gain, which is 16 plus kgs, no, that is not suggested. Because see, more weight gain increases more amount of abdominal fat and all, and sometimes more weight gain can also increase the baby's weight gain also. See, baby, you can think, yes, I can have a chubby baby and all, fine. But what happens is, when we are trying for a normal vaginal delivery, if the baby's weight is above 4 kgs, it will be very difficult. And suppose because of you gaining more weight, you can get sugar, you can get hypertension also, which is additional risk factor. Suppose a diabetic woman, what happens if she's growing weight too much? The like baby will gain weight, and there'll be fat accumulated on the shoulders. So when the delivery is happening, sometimes head will come and shoulder stuck, which is called as shoulder dystocia. Specifically, it is more common in women who have diabetes.
Okay.
So why diabetes? Because too much of weight gain, and you can get hypertension also, which will in turn decrease the size of the baby. Growth retardation can be there. So no, 16 plus kgs not recommended. And when we are delivering also, it becomes difficult for us, and even for the pregnant lady. See, already she'll be having 3 to 3.5 kgs, 3 to 4 kgs, including the placenta of weight on the tummy. And despite that, on that, if she gains weight, it'll be very difficult for her even to move, and she'll have more breathlessness and etc. and etc. So, and it is very difficult for you to shed those cages also. So please don't gain too much weight.
One last question. All thanks
Yes,
to
yes,
Bollywood, we
yes,
have
yes,
learned water break, run to the hospital, right? What they show in the Bollywood movies, the moment the water breaks, you run to the hospital.
Just rush to the ball.
Please tell us, what, because first time you're very scared, you don't know what is
Yes,
happening.
yes.
You just resonate what you have seen in movies, that water break and you stress out the husband, you make your husband go stressed out, the family is going stressed out. So what is the actual steps when you have a water breakage?
Yeah, see, firstly, when you feel that there is water breakage, it will be a gush of fluid like that. Most of the cases when you are nearing your delivery date. But suppose if you're just having drops and drops of water leaking, that can be because of your urinary thing also. That can be just your urine also. You should just observe it. So when you are going and to washroom, just sit on the commode even after peeing completely. Wait for the drops also to come off. So, like that, it will be better to differentiate whether it is urine or whether it is actual leaking. But suppose if a gush of fluid comes, then yes, it is water leaking. So, if there is water leaking, so basically amniotic fluid will be covering the baby and it will be protecting the baby. So when there is leak from that, what it means that whatever source of infection will be there in your vagina or whatever it is, it can go and infect the baby also. So in any water leaking case, proper water leaking if it is there, yes, you should really go to the hospital ASAP. But don't worry, it is not like emergency. You should go in an hour or so better. The earlier, the better. You just inform the doctor and the hospital, and then you go. And firstly, you should observe the color of the water. Sometimes, if there is greenish color water leaking, it means that the baby have passed motion. Then yes, then you have to rush to the hospital immediately, because
Yeah.
whatever if the baby has passed motion, that means baby can gulp it, and it can go into the lungs and stuck, which is an emergency. So first see the color. If the color is like transparent like water, then fine, you just pack your bags and just go, or else leave the bags and go. Somebody will pick your bags. So why? Because in 18 to 24 hours, we need to deliver the baby after water leaking. Because, as I said, it's a source of infection, and prolonged water leaking can lead to infections in the baby also. So, we need to deliver. Whenever you go to hospital, also, if you're not getting pains, the doctor will induce pains and will let you deliver. Or if it is a previous cesarean or anything, and they'll do a repeat section emergency.
So my last question for the day is, Doctor,
Yeah.
what are the common warning signs and symptoms during pregnancy which should not be ignored at all?
Yeah, common signs and symptoms. Suppose as any decreased movements, as firstly I talked about 12 to 15 movements in 24 hours is normal. But if you absolutely don't find movements for 3 to 4 hours, please do as I said, like eat or drink anything, lie down on your left side, concentrate on your baby. 40 minutes or 1 hour, if you're not feeling movements, please rush to the hospital. That's something to be taken care. It's okay if you go to hospital, get heartbeat checked, fine. If the doctor says yes, then perfect. Because sometimes if you neglect, it's okay, baby might be sleeping, don't come to a conclusion by yourself. Or you can just talk to your doctor and accordingly take a suggestion. So decreased fetal movements, decreased as in 12 to 15 movements, say less hua to, just yes, please rush to the hospital. Second one, any pain which is constant backache and constant pain in the abdomen, or tightness which is happening constantly, and I mean constantly, and then there is no relaxation, then you have to rush. Or any water leaking, as I said, any water leaking also, you should rush to the hospital. And any bleeding, suppose if you go to the doctor and if she had done a internal examination today, because you are nearing your delivery date, that day you might experience 1 2 drops of blood, fine. But if the amount of bleeding is increasing, or if you're having bleeding in the earlier trimesters, like first or second trimester, or before your 36 weeks, please go to the doctor. Sometimes you can experience bleeding without pain also, then also you should please go and meet that. These are the warning signs that you should immediately go to the hospital.
Okay. So thank you so much, doctor, for coming up. And today we wrap up this session for
Yes,
our live on pregnancy do's and don'ts. For all the users who joined in today, and for the people who will be listening later, I hope this information was valuable and
yes,
informative. Also,
yes,
please remember pregnancy is a unique and beautiful journey, and by following the do's and mindful don'ts, you can, have a healthy and nice and happy, beautiful pregnancy journey.
yes,
Prioritize your health, ask guidance from experts, and please don't deny the opinions and suggestions given by your doctor. Please trust your doctor in this process. They're trying to do the best for you. And so today I want to thank Dr. Sindhuri for joining us and asking us this
yes,
question, asking us and answering all the questions
yes,
for our users today.
yes,
Thank
yes,
you so much. It was a
yes, yes,
beautiful.
yes,
Thank
yes.
you so much.
Yes, yes, it's my pleasure. Yes, hope the session will be helpful for you. Yeah. Bye
We
bye.
hope.
Take care and have a healthy pregnancy. Stay positive. Bear a smile every day. And it's true that the baby hears your stories. Talk to your baby. So, see, if you're in any mood swings and all, if any sad things happen, that's okay. That thing also will pass on. Stay happy. Embrace the journey of your pregnancy with a positive note, and wish you all the best for all the pregnants and for who are planning for pregnancy also. Take care. Bye bye.
Bye bye. Thank you.
Yes,
Thank you, Dr.
yes,
Sindhuri.
yes, yes.